In the race to find a COVID cure or vaccine, antibody testing could be critical. With us now are Dr. Glen Hansen, Director of Microbiology and Molecular Diagnostics at HCMC, and Deepak Nath, President of Laboratory Diagnostics at Siemens Healthineers. Thanks to you both for being here. Dr. Hansen, what are the benefits of antibody testing?
Right. So antibodies are proteins that are produced in your body's immune system in response to infection. There are three major advantages and benefits to why antibody testing is important. Number one is that they show exposure of potentially individuals that have come in contact with COVID-19 or think that they might have had experienced COVID-19 with or without symptoms. Secondly, that information is very important for public health officials. It provides epidemiology data, which allows us to assess where the virus has been and where it's going as it moves through communities. And third, with the contents of the vaccines and the promise of the vaccines on the landscape, it will be important to have laboratory tests that will be able to measure an individual's exposure, their antibody response in conjunction with the vaccine.
And to you, Dr. Nath, what constitutes an accurate antibody test, and is it possible to get one?
There is several components to what makes a good antibody test. First, a test needs to be able to detect the type of antibodies that actually neutralize the virus. There's different kinds of antibodies, those that merely bind to the virus and others that not only bind but also actually neutralize the virus. So first, you need to have tests that are able to detect neutralizing antibodies. Second, there's two measures of accuracy in the diagnostics world. One is sensitivity and the other is specificity. What it roughly translates to is if a patient has the antibody, the test should accurately detect the presence of the antibody. And specificity roughly says if a patient doesn't have the antibody, the test should be equally good at being able to rule out the presence of an antibody. So what you're looking for with a test is a high level of sensitivity and also high level of specificity. And for antibody tests in particular, you want to look for the highest possible specificity, and the numbers that we shoot for in the industry are somewhere between 99.5% to 100% specificity.
Well, this one's on a lot of people's minds. What is the current state for a COVID-19 vaccine?
Right. So there's a lot of promising prospects on the market for the vaccines. There are 4 of them that have passed through or in our late stages of development phases. 3 of those antibodies look like they will be multiple doses in order to get your immune system to a point in which the vaccines are going to be effective. One of them looks like it might be a single dose. The data is still protected. We're hearing little bits of pieces come out here and there, but the data is still being reviewed under the scientific process. And we're hopeful that we'll have multiple vaccine candidates going forward to help us proceed with response to COVID-19.
Thank you very much, and let's hope for a vaccine very soon.
Thank you for having me.
Thanks for having us.
For more Business First AM, check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.